Good afternoon. I'm glad to see all of you here, friends and patients and caregivers. Now, my first question is, do you hear me well?
Yes.
Oh, beautiful, beautiful.
Yes.
Thank you. Okay.
Yes.
Yes.
Now, okay, I am glad to see the familiar face of my patients too. It's beautiful. Okay. Now, another very important question. When we take care of patients, the doctor has to be very focused in the care of patient so the care can be better. And the second one, when the doctor sees the patients, and if the patient improve, we are very happy. The reason because it is a journey to try to do better. And it is, let's say we talk about diet, we have the fluid restriction, we take medication. Do I do that for myself? Yes. So I understand the difficulty of the patient to stay in a good diet, to take medication on time every day, to be compliant. It's very beautiful. So when I see the patient improving, it is a joy for the doctor, not just for the patient. So just remind you that, okay? Now, today we talk about a very common problem. It is heart failure. And so we have patients with weak heart. Yes, we know the patient has heart failure. But let's say now, if the patient become older, and as the physicians, we are older too. And then do we have heart failure due to aging? I say yes. So I practice what I preach. Today, I show you everything, and I practice what I discussed today. So I understand the patient very well. I'm happy to see the patient improving, okay? Now, it is an informal talk. So if anybody has any question, just you can raise your hand. I can, let me see. The staff of the hospital had to unmute you. And so you can talk, you can discuss. It is, you can stop me anytime and ask question anytime. Hello, help desk. Can you unmute the patient and the guest?
Yes, but each patient, each participant can unmute themselves if they need to.
Okay. You see, so you can unmute yourself, and it is anytime you have question, just speak up. Okay, now let's go. So today we just talk about how do we know that the patient has heart failure, or how do we know that the heart failure is ongoing, and what is the treatment? Okay. So the first one, what do we mean? What does it mean when you say this patient has heart failure? What do we see? We see what are the signs saying that the heart failure is not controlled? And then when we see, the second question, what does the patient feel? In medicine, we call symptom. I mean, we want to know how does the patient feel? What does the patient have complaint about? You see? And the sequence, how do we know when it starts, when it's early or when it's late? And the treatment. So here's the symptom. So we have many. Shortness of breath, swelling of the leg, fatigue, cannot sleep, lying down, swelling in the stomach, cough, go to the bathroom too much to urinate at nighttime, or confusion. But not every patient has every symptom at one time. Maybe at the end stage, they can have all. But the majority of patients has the problem only one or two. But if we know When we see that, and if we know, we prevent early, so many patients can live a normal life. This is the beauty of it. Yesterday in the office, I saw many patients with bad heart, but in good condition. Diet, medication, exercise, they can live a normal life. This is the key. Every patient with heart failure can live almost a normal life if we sure we comply with diet, low salt, and take medication, exercise gently, and the patient will do very good. So it's not like 20 years ago. The patient with heart failure came to the hospital every 3 months, 4 times a year. It was normal. But now, if the patient arrives to the hospital once a year, because heart failure is a big number. You see? So you see that's a symptom. Now, so what about, so that we have to say, how do we know that the patient has fluid overload? So the first one, it is in the abdominal wall. The first area, the fluid is retained in the body, it in the abdomen, in the wall of the abdomen. So the patient, so then the second one, and after that, it is in the leg. We used to look at the leg, but this is second area for fluid accumulation. Then in the back of the thigh, especially the patient who lie down, stay in bed a lot. They don't have water in the stomach. They don't have water in the leg. It is in the back, especially in the morning. Now, number 4, and in the liver. You see how the big belly here, you see? Then the next one, at this time, the patient has fluid overload in the lungs. At that time, the patient complained being short of breath. Not right away, not from the beginning. Now the shortness of breath, and now we see that the vein in the neck. This is the highest point of the body. When the patient is standing up and we see the vein in the neck distended, we know that we are in trouble. You see? Now, I just show the 6 pictures of heart failure for patients. Does anybody have any question or any comment? You can unmute yourself and talk, okay? Okay, now then we go to the next step. So we know that the main feature of heart failure is fluid overload because the body retains too much water. So now, if the patient retains too much water, how does the patient feel? Let's see. So many times, and especially the patient, if the patient has been doing well, and the patient came to the office and say, I was surprised. I felt heavy in my stomach. No swelling in the leg. Then we have to be careful. You see? Because this is the first area where the patient has fluid retaining. So it's the stomach. The patient feel heavy in the stomach. Then the second one. At that time, the patient has, now the patient has swelling of the leg. Usually, the patient does not have pain in the leg. But if it is the first time with a swelling, it's quite painful. I saw one patient like that. I was just very surprised because we were not taught like that. But in fact, the patient complained of pain. But with the lung and the long-term chronic swelling, and no pain. Number three, the patient feels tightness in the thigh. Number four, this is a very common one. If the patient has liver congestion, the patient feels lousy, no energy, irritable, and angry. If the patient lie down, doesn't feel good, standing up, doesn't feel good, walking, doesn't feel good, eating, doesn't feel good, this is because too much water in the liver. And the patient unhappy, irritable. See, it's not because of brain. It's not the patient had unstable emotionally. It's just because the liver is congested. So when we take away all the water in the liver, patient feel much better, plenty of energy. And this is why in patient with heart failure, we have to be sure the patient can function normally and live happily. The patient with heart failure and good treatment, they can live normal life. They don't feel tired. They don't feel exhausted. They don't feel irritable. And they emotionally stable. You see, it's very important. Okay, now this is the liver. Then another one. How do we know that the patient had too much water in the stomach? If the patient had fluid in the lining of the stomach, we call gastric edema. The patient can feel hungry, go to the kitchen, prepare a sandwich, and just eat half of the sandwich and feel full. The patient is surprised because the patient was hungry just 30 minutes ago and now just ate only half a sandwich and feel full. So the patient stopped eating, and 2 hours later, 3 hours later, hungry again. When we see the patient had, we call it early satiety. If the patient feel full quickly after a small meal, this is a sign of fluid edema in the lining of the stomach. So let's say now the patient is in the hospital, day 3. So the patient improve. And usually I ask this question, how is your appetite? Do you feel hungry? If the appetite improves, if the patient feel hungry again, we know that we take away the water in the stomach. You see? Now, after that, then the patient when the patient have water in the lungs, just a little bit, and the patient feels short of breath with activities. This is why I used to ask the question, what happens when you walk? How far can you walk? And when do you have to stop? In a normal person, they can walk miles and miles and miles. I saw a patient yesterday, with heart failure, in good treatment, good management, he can walk miles and miles and miles. The heart failure patient doesn't have to suffer anymore. And this is good news for the patient. But we have to prevent the problem first. Then when the patient has weakness of the heart, then we have to have a diet, low salt diet, restrict the amount of fluid, and exercise gently first. If we don't exercise, we have deconditioning. You see? So this is a 6. I go back. Number 1, heavy sensations of stomach. Number 2, complaint of leg swelling. Number 3, tightness in the thigh. Number 4, this is very common. Tired, exhausted, no energy, irritable, angry to other people's and to herself or himself. This is the one. And then early satiety. Hungry, but feel full quickly after a small meal. And the last one, shortness of breath with activities. It's very important, you see? Because if the patient does something, wants to do something and start to do something and become short of breath, patient feel very agitated, feel very frustrated. See? Now, so, and the last one, when we see the patient feel short of breath at rest, we know we are in trouble. Because if the patient, a patient with heart failure, with enlarged heart, can live a normal life. And now, even at rest, sitting down or lying down and complaining of shortness of breath is dangerous. How the patient can walk? How the patient can take care of himself or herself? If the patient has shortness of breath at rest. So it's very important for us to see that. You see? Okay. Now, I saw quite a few. Today we have quite a few guests here. I just remind you that first, I'm glad to see everybody, many patients of mine, very familiar face. And I like to summarize that simple thing like that. Number 1, a patient with heart failure can live a normal life. This is very important. It's not like 20 years ago, they become disabled. Yesterday is Tuesday at my office, the afternoon. I saw 3 patients with ejection fraction 25%. They live a normal life, they work, and they can function everything. And this is good news. So how we can achieve that? Number 1, diet. Diet, very important. Low salt diet. Number 2, cannot drink a lot of fluid. And number 3, need to exercise. Because if we don't exercise, we have deconditioning. The heart is not used to exercise, so become tired very quickly. And if we do 3, and then number 4, we have take medication. We have very good medication now. I remember I have a patient, he's a doctor, and the patient had open heart surgery as a baby from congenital heart disease. And he came to the hospital 3 times just because feeling tired. And the test done, the ejection fraction is nearly good. And I kept asking why this patient has shortness of breath and fatigue, and we didn't find anything. So I realized that because he had congenital heart disease And he had surgery as a baby. At this present time, his body tried very hard to stay alive and to function as best as the heart can do. And all the tests look normal, almost normal. So I say, that means this patient did try very hard and he achieved like a normal person can do. That means he tried so hard already. The heart tried so hard already. So I start the patient on medication for heart failure. And 2 weeks later, I saw the patient. And he said, I feel much better. It's very good. Because the heart tried very hard to achieve what a normal person can do. This is why he feels tired. And so we give the medication. We want to be sure a low salt diet, doesn't drink a lot of fluid, and exercise gently, and take medication for the heart, and the patient can live a normal life. So I wrote a paper for him to go back to the gym. You see, 20 years ago, we didn't have that. 20 years ago, the patient with heart failure came to the hospital 3 to 4 times a year. Now, in 2020, if the patient arrives to the hospital once a year because of decompensation of heart failure, it's a big event. We have to say, did the patient have good diet? Did the patient drink too much fluid? Did the patient have salt in the food? Did the patient exercise? Or did the doctor give enough medication to patients? You see? It's not all the time it is a fault of the patient. No, I am very practical and very frank and sincere with my patient. I all the time have to stay focused and ask, did I do what's best for the patient? Why the patient does not improve? You see? And I mentioned before, there are 2 kinds of heart failure. The one heart failure because the muscle of the heart is so weak. But there is one heart failure due to old age. And does the doctor become old? We say yes. Does the doctor have heart failure due to old age? We say yes. And how to prevent that? You see? I mentioned that for myself, I have a low salt diet. I drink when I feel thirsty. I exercise, and I practice what I preach. Today, I told you everything. And remember, I do the same for myself and my family. And when I see the patient with heart failure improve so well, can function as normal person, it's beautiful. I mentioned at the beginning, yes, the doctor many times bring happiness to the patient because the patient improves. But the patient also bring happiness to the doctor because they do so good. You see? And the doctor has to stay focused in the care of patient. If not, we don't remember and we make mistake. One day, one patient asked me, do you work? Do you continue to work or do you want to retire? I said, one day I will retire. He said, why? I said, I have to stay up to date to be sure the patient has the best treatment as anywhere else in the world. I cannot, if I continue to work, I have to stay up to date what's the newest treatment for the patient. I cannot give the information I got 20 years ago and treat the patient of today. For example, I don't take care of diabetes. Why? I learned diabetes 40 years ago, 30 years ago. So I don't have time to update my skill and knowledge in diabetes. I don't do it. I stay focused on the heart and up to date what happened, what's the best treatment in the heart for the patient. You see? Okay. Now, I remind everybody, we have quite a few people here today. I'm happy that we have quite a few people. So I remind you, if anybody has any question, you can unmute yourself. You are very good because you know how to use the Zoom to be here today. I see your pictures, and then you can unmute yourself and you can ask questions.
I have a question.
Yes, please. Patricia, right?
Betty Villarreal.
Oh, yeah,
Yes.
Betty, yes.
Yeah.
I'm listening.
You mentioned not to drink a lot of fluids when you're exercising, or other doctors tell you to drink fluids because it makes you not so tired. So you're saying not to drink a lot of fluids. So how much fluid should you be drinking?
Okay. I will have the picture later. Here, you see the fluid here. Here. Okay. Normally, it's 64 ounces a day. I said normally. Now, the patients take 64 ounces a day. But what about we are in the summer and the patient working outside in the yard, and the patient have a lot of sweating. So the patient loses a lot of water and the body become thirsty. Then the patient have to drink more. You see? Now, what about in a winter day when it is cold and snowy, and the patient stay inside the house, didn't lose any fluid from the skin, no sweating, then the patient had to drink less. You see, same patient, same cardiac condition. In summertime, I say you can drink more. And in wintertime, I say you have to drink less. It's up to our body. If you feel thirsty, you drink.
I have another question.
Yeah, please. Carmen, right?
Yes.
Thank you.
Yes, Carmen, thank you. There are some medications that the doctor may say you need to drink plenty of water due to their effects. Or I was taking the potassium a little while back, and the doctor said, well, take plenty of water. Now, I don't have congestive heart failure at the moment, but if you are retaining, and I was taking a nifedipine, then the doctor gave me nifedipine. Of course, I found out retains fluid, so the doctor gave me, without changing my prescription to another blood pressure medication, she added a water pill to take off the water, and then she added potassium to replace the potassium I was losing because of the water pill. So for individuals who have fluid retention, and then you're told to drink plenty of water, would that kind of be like more danger to further fluid retention than usual?
So thank you for the question. Very beautiful and interesting question, very practical. All the time patient has this problem. So the first one, my first principle is more medications, more side effect. Less medication may be better. See, number one. Number two, we don't give one medication, and because side effect of that medication, we give another one. So suddenly we have to give two more medications. You see, there are medications that can retain, cause side effect is swelling the leg. One of that it is amlodipine, and the second one in procardia, is the one you mentioned. It can do that. You see. So in my way, I prefer to. There are many ways to do things, but in my way it is less medication is better. So if the patient develop swelling because as a side effect of the medication, don't give it. Take a different one. There are other ones, you see. And the potassium is good. But too much potassium, let's say one day the patient has retained too much potassium, then it's dangerous. Then we have to take the blood test. How we know the patient retained potassium? We have to do the blood test. So when we do the blood test, the patient has to go to the hospital, have a stick in the painful stick to take the blood, had to pay, and then 3 months later need another one. Because let's say, for example, if the patient had blood pressure, potassium of the normal one is below 5, and the below 5 or above 3.5. So let's say the blood pressure, the potassium is 3.6. So we know that it's okay now, but then a few months later we have to check it again. So it's not good for the patient and to have all the times a blood test, because it's not convenient for the patient, it's painful, and it's costly. So it's better that don't use it, you see? But if the patient needs the water pill, hydrochlorothiazide, furosemide, then the patient, most of the time, the patient needs potassium. And then we have to check. And let's say, for example, let's say the patient, what is the sign of low potassium? So one day, let's say the sign of low potassium, the patient feels very weak, very tired, very weak, cannot lift the arm. So let's say patient calls the office, say, oh, I don't know why I'm so tired. So we have to look at the medication and say, oh, we have to check the potassium level. You see? So like I mentioned, if we have, at this moment, by the guideline, there are only 2 medications the patient has to take it, no exception. There are 2. Number 1, we call Entresto. That means this is the newest medication, and the second one is beta blocker, like a low pressure metoprolol, thing like that. Diuretic water pill is optional. It's not a must. If the patient have low salt, good low salt diet, and does not retain water, does not have to take water pill. So let's say if the patient is in good shape, and sometimes the patient have some swelling and concern about that, then I say, okay, you have the water pill here, 20 milligram furosemide. Be sure you have a low salt diet. And if you have too much swelling in your leg and you're concerned, you take extra 2 to 3 days water pill, furosemide. The day you take the water pill, you take the potassium. You see? But if the day you don't take the water pill, don't take the potassium. You see? So this is the answer to your question. It's a very important question because I mentioned the patient is very good, 2,000 cc of fluid a day, and good diet. Wintertime, she comes to the office, and I concern her she is fluid overload. And in summertime, I'm afraid she is dehydrated if she works too much outside in the yard. You see? So the key is, do you feel thirsty? If the body doesn't have enough fluid, we will feel thirsty. Or I see one thing very clear. If you have too much salt in your food, you will feel thirsty. This is my own experience. Any day, unless at dinner time, I have too much salt in my food. At night time, I'm still thirsty. I have to go to drink. Okay, so
Thank you.
thank you very much. Now, does anybody have any other question? We have 2 very good questions, very, very important question. Okay, now so let me recap. Okay, so people can have. Let me see the time. 4:30 is good. We finish in 10 minutes. I have 1 hour, but all the time we are very time conscious. Do less, better. When I lecture in China or Japan or Korea or in the US, everybody has 15 minutes only. And we have 10 minutes to impress the audience and 5 minutes for damage control. If we see that the audience is not very happy, we have 5 minutes to correct it. If not, next year we don't have invitation to lecture. Okay. So here we have the symptoms: shortness of breath, swelling of the leg, no energy, cannot sleep lying down, swelling of the stomach, cough, too much, they have to get up too many times to go to the bathroom, and confusion. But not everybody has everything here, unless they're end stage. So the first one, swelling of the leg, heaviness in the leg, in the stomach. 2, swelling of the legs, most easy one to see. Number 3, swelling in the back of the thigh. Number 4, retention in the liver. Number 5, fluid in the lungs. And number 6, we have water in the vein, in the neck. When we see this one, at the end stage already. Now, so how does the patient feel? The patient feel heavy in the stomach. And I saw my patient say that. Some patient came and said, I feel my stomach heavy. 2, leg swelling, we know. Number 3, not heaviness, but feel tight in the thigh. But this one is very common. Many in women. Liver congested, they feel lousy, exhausted, no energy, irritable, angry with other people or to herself or himself. It's not she is a bad woman. It's because of the liver is sick. And when we took the water out from the liver, she's doing very good, doing much better, feel better. Okay. And another one, it is the patient has we call early satiety. I mean the water in the stomach. And the last one, the shortness of breath with low-level activities. Walking, I ask the patient, how far can you walk? Some people can walk from the bedroom to the dining room. Some people can walk more, but at this moment, with patient in heart failure, in good treatment, they can live a normal life. It's very important. I mentioned before, yesterday, Tuesday, I saw 2 or 3 patients with bad heart, in good condition, working, and one working physically, not just the desk job, and live a normal life. I was very impressed with the patient because I remember he came to the hospital after day 2, and he said, I need to go back to work to make a living, to support the family. And we have to do everything for the patient so the patient can come back to a normal life, live a normal life, and support the family. You see? And see here, then, so it's a sequence. You see, stomach first, then go to leg, thigh, stomach, liver, lungs, and neck. And now, after we treat the patient very well, so how I come to talk to the patient, I say, do you feel short of breath? And she said, I don't have any shortness of breath. Then I asked, how's your appetite? And she said, oh, today's appetite is better. So I know that patient improved. Less water in the stomach. And then I asked next question. The next day I asked, do you feel exhausted? I said, oh, it's not exhausted like when I came in. We know that the patient had less water in the liver. And then at that time, I look at the leg. You see? Now, so the first one is low salt diet. I mentioned before, I practice what I preach. I told you today, low salt. Do I have a low salt diet? I said, yes. When I go to the restaurant to eat, does the food taste good? Yes. because it has salt. You see, first one, low salt, no salt. Number two, here's a fluid. Normally, 2,000 cc of fluid a day. You see? And number
I
three,
have a question again, please.
yes, please, Carmen.
Um, I know that the white salt has been refined, the table salt and so forth. So I don't use any of that. But is any and salt is salt. But is there any difference in maybe cooking with Himalayan salt or the pink salts that are so popular now versus the white regular salt?
Okay. So you mentioned very important. Salt, no salt, table salt is one. Himalayan salt is also salt. It is from the sea. But the only difference is the red color. It is real salt. So we can take, for cardiac patients, they can take salt substitute. That one is okay. Because let's say, what is the salt? Salt is sodium chloride. Anything sodium is not good. So what about in the salt substitute? What does it put? Magnesium chloride. It knows no sodium. So this is why when we cook, instead of put salt, you can have seasoning, spices, so the food tastes good, but no salt. And that one is very clear. And I mentioned I practice what I preach. I have low salt diet. I understand how difficult it is, but it is doable. And you don't want to feel tired. You don't want to feel short of breath. You want to be energetic. You think you can do things. You can function. You can work. You can smile. Let's say, for example, for fun. Let's say you are invited to come to a party. It is a normal party, Saturday afternoon. When you come to your friend's house, you have to smile. You have to look energetic. You cannot come and feel tired and lousy and sit down all the time. You see, we have to be in good shape to live functionally, normally, beautifully. You see, and it's doable. This is the key. It's doable. And the last one is the medication. So there are two medications you have to take it. The first one, the new one, is the Entresto. It's a miracle drug, and I saw many patients use it and happy. The second one is the beta blocker. The third one, anything else, the diuretic is optional. It's very clear. It's not a must. It's optional. If you retain water, then you take it. If you don't retain water, it's optional. You see? Okay. And this is it. Okay. So conclusion, we see here. Okay, and three things. We remember low salt. Restrict the amount of fluid. And take medication, complying with medication. And I finish. And do we have any other questions? So thank you for being here. Very nice question. And I see that. Yes, please.
This is Betty again. How do you spell that medication?
Okay. To spell it?
Yes.
Entresto. E-N, T like a Tom, R like a Robert, E like a Elizabeth, S like a Sam, T like a Tom, O like orange. Entresto.
Okay. The other thing is this removes the water from the liver, the stomach, the feet, all the stuff. That's what that medication does.
No, the Entresto has two in it. One is sacupril and one is valsartan. Valsartan is angiotensin receptor. It has some degree of to remove the water, but it makes the heart stronger. And this is more important because 20 years ago, we didn't have Entresto. We didn't know about beta blocker. We used only water pill. and we retain water, the patient retain water, and the patient retain water, and we give the medication, retain the fluid, and we take the fluid out, and the body reacts strongly and retain more. The patient tries the best. The doctor brings the happiness to the patient, but remember, the patient brings the happiness to the doctor too. I'm so happy when I come to the room and the patient improves. And when the patient doesn't improve, I kept ask question, why this patient doesn't improve? See, we have to stay focused. Then the second one, the important, I practice what I just told you. So you are not alone. We are on the same road. And I see the result. Okay.
Thank you very much.
Thank you
Thank
for
you.
the
So let
information.
me
Very
summarize.
informative.
Okay. Yes.
Thank you.
Very informative.
Yeah.
Thank
So
you for all the
remember,
information.